One of the biggest and most important choices that you have to make when you turn 65 is making the decision whether or not you want to be in a Medicare Advantage plan or if you want to be in a Medicare Supplement plan. The reality is that this choice does matter, and it could affect you whether it's financially or whether it's your access to healthcare. The good news is, once you understand the difference between the two, you'll be able to make a choice and choose the one that benefits your lifestyle, financially, and medically as well. I'm going to make sure to explain to you the ins and outs, the pros and cons, and also what is required for Medicare Advantage plans and Medicare Supplement plans. My name is Kervin Crawford Lewis, owner of Pure Life Health Insurance, and today we're going to take a deep dive into the difference between a Medicare Advantage plan and a Medicare Supplement plan. Just to be clear, if you have a Medicare Advantage plan or a Medicare Supplement plan, neither one is better. It all depends on your situation. Now, before we get started, I just need to clarify that in order to enroll into Medicare Advantage plan or a Medicare Supplement, you must be enrolled into Part A and Part B of Original Medicare. Now, remember, Part A is your hospital benefits and Part B is your medical benefits. For most of you, you probably already have your Part A because you worked for at least 10 years. As for your Part B, you must enroll into your Part B and you must pay a premium of $202.90 every month while you're enrolled in your Part B premium, whether you're in a Medicare Advantage plan or if you're in a Medicare Supplement. So now that we have our foundation, let's go ahead and get started. So first, let's go over our Medicare Supplement, also known as the Medigap. Now, with the Medicare Supplement, this covers the remaining 20% that Original Medicare does not cover. Now remember, Original Medicare covers 80% of your medical bills. Now this 20% is covered either by Medicare Supplement or Medicare Advantage. When it comes to supplement plans, you pay a monthly premium, and then they pay for your co-pays, your co-deductibles, and your co-insurance. Now, these monthly premiums usually range between 100 to 200 depending on your area, your zip code, and your age. With the Medicare Supplement plans or Medigap plans, these plans are usually accompanied by a letter. For example, a Plan G, a Plan F, or a Plan N. Now also, I want to let you know that when you enroll into a Medicare Supplement plan or a Medigap plan, you have the freedom of choice to choose any doctor that accepts Medicare. You're not restricted and you can see any doctor that you would like to see. So if you travel frequently or if you go visit family in different states, I would recommend to have a Medicare Supplement plan so that way you can make sure that you're never anxious about getting medical coverage wherever you are. During your initial enrollment period, when you have the open window to join a Medicare Supplement, I advise to always try to get a Medicare Supplement plan because when you turn 65, you have a guaranteed issue regardless of any health conditions without any underwriting. So that means whether you're going through cancer, leukemia, or any other type of medical disease, you will still be accepted in this Medicare Supplement plan when you have your initial enrollment period. Remember, your initial enrollment period is this month window with your birthday. Let's go over the cons. It does get a little pricey month to month depending on finances. For example, the Medicare Supplement, they usually range from about $120 to $250 depending on your age, the area, and the type of plan that you select, whether it's a high deductible or a low deductible. Also, do not come with a prescription drug plan. So you will be responsible for purchasing a separate prescription drug plan in order to get your medications. Plans don't typically include vision or hearing. So let's go over the math to see how much it will typically cost for a Medicare Supplement plan. Go ahead and add $175 for a plan and $80 for your prescription drug plan. You add all those up together, so that would be $427.90 per month. For some people, that could be a lot. So maybe it may not be for you. Maybe you're super healthy and you want to save some money. So let's go ahead and take a look at our second option, which is called a Medicare Advantage plan. Now, a Medicare Advantage plan, private insurers combine all three of your Part A, which is your hospital benefits, your Part B, which is your medical benefits, and your Part D, which is your prescription drugs. They bundle it all up and they give you what's known as a Medicare Advantage plan, or better yet, known as Part C. Now, a benefit of these plans are that they do include dental, they include vision and hearing. One of the big differences with these plans from a Medicare supplement is how the pay structure is organized. Instead of you paying for your monthly premium every month, you pay as you go. So you're responsible for co-insurance, your deductibles, and co-pays when you go to the doctors, your specialists, the ER, or even your urgent care. I also want to let you know that every plan has a maximum out-of-pocket cost, which is capped at $9,250. This means that there is a cap on how much you will be spending with the Medicare Advantage plans for the year of 2026. Here are the trade-offs. You usually have to work with a certain group of in-network doctors, and these plans are accompanied by an HMO or a PPO. So let's go over the terms HMO and PPO. These are two important things to understand. With an HMO, it is a little bit more restrictive, so that means you cannot go out of network, and you need a referral to see a specialist. Now, these plans do have lower copays and co-insurance compared to a PPO, where it does cost more in order for you to go see doctors out of your network. However, you do not need a referral in order to see your specialist. When choosing a Medicare Advantage plan, it is very important to understand the network and to also understand what your provider will cover, whether it's an HMO or a PPO. Those are two things that is very, very important to understand. When it comes to choosing a Medicare Advantage plan or a Medicare Supplement plan, it really comes down to your budget, your health, and your lifestyle. With a Medicare Supplement plan, you could see any doctors that you want. Your out-of-pocket costs are virtually zero, but you do pay a higher monthly premium. If you have a chronic illness or are going through health conditions, I do advise you to enroll into a Medicare Supplement plan when you can. With the Medicare Advantage plan, you do have lower copays and it does include dental, vision, and hearing. However, you have to remember this is a pay-as-you-go type of plan, and typically you do have to use a network of doctors. If you're feeling overwhelmed, this is what I'm here for. At Pure Life Health Insurance, my services are free to you. My contact information is down below and will be on the screen. If you found this video helpful, please hit the like button. And thank you so much for watching. I really hope you learned something today.
I just wanted to let you know that I hope you have a wonderful, fantastic, positive day.